News at this hour, I'm Juliette Goodrich. Santa Clara public health officials are making an announcement in response to the coronavirus outbreak. Let's listen in now live with Dr. Sara Cody.
That's the order that we have around the Bay Area, the 6 core counties around the Bay Area. We're looking at our data every day, as I'm sure you are as well, on our website. And what we're seeing is we have reason for cautious optimism. So I would say we're not out of the woods, but we are making the progress and slowing things down in the way that we had anticipated that we would with this shelter-in-place order. So the number of cases that we see every day are somewhat stable. They're usually in the 50 to 100 new cases a day. We are seeing the deaths increase, although slowly. So what this tells us is that the big tool that we had available to us, which was to issue a shelter in place and do everything we could, both through order and through encouragement and through collective action to slow things down. So the collective sacrifice and action that everyone has taken across the county has been protective. However, I want to emphasize that we are by no means out of the woods. We're still probably at the beginning of what is going to be a very long marathon here in the county, across the region, and indeed across the country. So what we're doing right now here in our county, in the region, and across the state is thinking very carefully about what do we need to have in place in order to ease this very broad mitigation, this very broad shelter in place. And I know that that this is what everyone is talking about and everyone is thinking about. It's enormously complicated. But basically what it looks like is we would not want that, as I mentioned, the shelter in place is our major tool, but as you know, it's not very focused. And so the question is, how can we transition to more focused measures? In order to do that, one, we need to make sure that the hospital capacity that we have given time for hospitals to create, we have to ensure that it's adequate. And that's not just beds, but of course, that's staff, and that's staff that are protected. And those staff need adequate quantities of personal protective equipment, and they need to have a reasonable and safe supply. Second, as we know, we have not had sufficient capacity for testing. Now that we understand that there's a significant degree of asymptomatic cases, you can have an infection and no symptoms at all, as well as the understanding that people can become infectious up to 2 days before they start having symptoms. All of that tells us that in order to identify people who are infected and infectious, we need more widespread testing. And this is something we're endeavoring to understand. What are the levers that we have locally to increase capacity, and to what extent do we need to extend on partners at the state and national level and in the private sector. Third, we really need to, not just here in our region, but of course across the state and across the country, we need to ensure that we have the capacity to do case investigation and contact investigation. And remember, at the very beginning of this epidemic, that is where we had all of our resources. We had huge teams. We had colleagues from the Centers for Disease Control here embedded with us, where we carefully followed every case and every contact. We can't do it the way that we did it at the beginning of the outbreak. Our case numbers are too high. But once we begin to settle those case numbers down, then we can transition to a more focused effort. As you could imagine, all of this takes enormous planning and it takes time. And so we're using our time now while we have the shelter in place order to do that planning. And we're doing it in collaboration, as always, with our colleagues around the region and around the state, because we're a very interconnected society, and we obviously can't do this alone. So that's where we are. Again, our take-home messages are that the collective action here in our county and across the Bay Area has increased safety It has lengthened the doubling time. It has settled things down, but it's not enough. We're a month in, and we need to keep at it for a bit longer. Thank you, and I'm happy to answer a few questions.
Dr. Cody, can you tell us who is going to make the final call for Santa Clara County? We're hearing President Trump says he's going to make it. The governor is already announcing today some strategies for when restrictions are lifted. Are you going to make the final call for this county? Who is going to make the final call for Santa Clara County?
In California, there's much authority that's given to the local health officer. So you'll remember in March, I started issuing orders. First we had recommendations, then we had urgent recommendations, and then we had health officer orders. So the first order, as you may recall, was to ban gatherings greater than 1,000, and then we scoped that down to greater than 100, and then ultimately issued the shelter-in-place order on March 16th. So health officers in California have quite a bit of power and authority to protect the health of the population. In general, and I would say the state health officer also has powers, but in general the way it works is that if a county health officer decides that to protect the population that we need to be, say, more conservative or more restrictive, then we can be. So a state order might be less restrictive than a county order. It's I don't think I've ever I can't think of an example where a state health officer has issued an order that supersedes a county's to make them less restrictive.
So can you just clarify those criteria that you just mentioned to us today? Is that, in your mind, what you need to see happen before you would feel comfortable easing restrictions?
So these are not so much, they're not specific criteria. Notice I didn't give you any specific metrics. These are, I want to make sure that I communicate to you all and to the public so that you understand the different areas where we're looking very closely so that we can know and have a way to measure where we are and sort of the level of protection for our community. I also just want to acknowledge that all of these decisions, these are all extraordinarily difficult decisions because we're trying to understand what the impact of each decision is going to be. And of course, the shelter-in-place order, while we do have good evidence that it slowed the infection down and reduced harms from COVID-19, of course, we also know that there are harms from the shelter-in-place. There are health harms from the shelter-in-place, both from social disruption, from economic disruption, and even more immediately, for example, if someone doesn't feel like they want to go in and access preventive health care. So we're trying to, as best we can, understand the impacts and then navigate a course that, to the greatest extent possible, minimizes the harms and is most protective. But it's a very complex set of decisions.
Dr. Cody, what are your thoughts on a mandatory mask order? We've seen them go into effect in Contra Costa County to a certain degree. You thought about that? Where are you with that?
So, as you know, we have recommended universal face covering. We have not used the word masking for a very particular reason, and that is because we're sensitive to the fact that we don't have adequate personal protective equipment. And unfortunately, we're still needing to make decisions and communicate our priorities for personal protective equipment, which includes medical grade masks. However, we do have some evidence that covering your mouth and nose when you're out and about and around others does add a layer of protection. That, in addition to social distancing and frequent hand washing and other hygiene measures.
So for now, it's a recommendation.
For now, it's a recommendation, a strong recommendation.